lights are out.
Throw this out too about the study about even though there's access, people are still not eating Welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and I am excited. We have a guest. It's actually our third time being on. We've always enjoyed having her. I think one of the brightest professionals, women, particularly professionals, that I've ever had the opportunity to speak with, and I'm excited. This is Dr. Karen DeSalvo, Health Commissioner of the City of New Orleans. Thank you.
Thank you, Chris. Thanks for having me back. It's really nice to see you.
No, it's always exciting, and people that they're familiar with the show, they've seen you before and heard you speak. But you here actually the main focus, and we'll talk about it's called FitNOLA. Let's talk about FitNOLA, and we're going to bounce off there a little bit.
So FitNOLA is a city initiative that is the health department's leading, but is done in partnership with over 100 organizations, small and large.
Okay.
That's goal is to have a physically fit New Orleans by 2018.
All right.
2018 we picked that because that's the 300th anniversary of the city of New Orleans.
Wow.
And so we all felt that if we could be physically and nutritionally fit by 2018, one of the top cities in the U.S., it would be a great way to celebrate that 300th anniversary.
What a goal.
Yeah.
Right. Wait, 2012, if I do my math. 6 years.
I know it's going to come. It's going to come before we know it. But you know, it's really, I've been in this job as health commissioner now for about 18 months.
Okay.
And one of the early things that we knew we wanted to do was to tackle childhood obesity. It's a winnable battle. It's something that First Lady Michelle Obama has taken on and done a tremendous job with. We very early said we want to be a Let's Move city. That's her program.
Right.
And so we began to say, if we're going to be a Let's Move city, what does that mean for New Orleans, right? Because we are special. We have our own culture, our own relationship with food. We have our own relationship with fitness and exercise, right? And we need to make whatever we do here in New Orleans work for us. It has to fit for us. So we asked school children and parents and teachers and businesses and healthcare experts, public health professionals, social service agencies, corporations to come to the table with us for a series of months and talk about what it would mean to be a FitNOLA and how we wanted to get there. And I'll tell you, one of the early lessons that we had was that kids told us, let's not talk about obesity. What we want to talk about is being fit. So the name FitNOLA is from the kids, and it's an honor to them, really, that we want to make it focused on a positive angle and not on that negative label. They're very empowered about this. They know that their brains work better and that they have more energy. They're going to do better in school if they're nutritionally fit and they have a chance to be physically active. And there's a point in their lives where that kind of starts to fall off, and they want to work with us to see that that doesn't happen and that they get to this place where, yes, we tackle the notion of obesity, but we're doing it in this really positive way that everybody can be fit no matter where they are on that chart.
I think you went right to the experts. Nope, out of all of the big gurus and the bookie books and all of those, it was the kids who came up with the right idea.
You know, they do often. In public health, we have learned that children are excellent advocates and they have great ideas about how to communicate complex ideas simply. Smoking is a great example. Children had a huge impact on reducing smoking rates in this country. We worked with them. I wasn't part of this movement, but this is a place where people said smoking's bad, and kids said, "Yeah, we get it," and we want to make sure that we push our parents and the adults around us to stop smoking. And here's ways that we can message that. And it really had a dramatic impact. And so the model of that is what we're looking at for our own FitNOLA program.
Oh, you got it. It just came to me. All right, because it wasn't on the whole questions. All right, so we're not attacking obesity. We're building fitness.
Yes, we are. That's exactly
let's change it.
right.
All right, kids, I got it. All right, we're not, who wants to deal with the negative? Let's deal with the positive. We want everybody to be more fit. Let's be more fit. Let's be more fit.
Nutritionally and physically, right? So it's about what the nutrients are that come in your body,
Okay.
and the balance of those, and then
right.
also, yes, about being active.
All right. And a challenge, in New Orleans, like you said, we're a special city, so we have issues in New Orleans. Live to eat, eat to live.
Yes.
Other cities, and we hadn't talked about it, but other cities, just reading about it, been having major questions. New York particularly, it took out the trans fats.
Mm-hmm.
All right, and so forget the mayor, and he says that, okay, fine, we're going to do that, but we're going to also start limiting the sizes of drinks. There's a guy in San Francisco says nobody needs a 64-ounce soft drink.
So yes, there's an approach that has recently been in the papers quite a bit. In fact, I think you're going to see it nationally and locally, even here, because the health commissioner in New York is from New Orleans.
That's right.
That's
Tulane.
right, Tom Farley, and
yeah.
Their approach, Mayor Bloomberg's approach, has been aggressive, and they've had some successes with their sort of limiting and/or putting out in the public domain sort of what are the choices that you're making. And in fact, some of the policies, like the calorie counts on menus, have found their way into national law. So the Affordable Care Act, assuming it all stays in place, will lead to that kind of display of calories and nutritional content of food at places all over the country.
Okay.
So what people are gaining in New York, where they're learning to make smart choices when they go places, will have access to that without having to actually enact it. I will tell you, though, that also recently people might have seen something that Disney did, which is a slightly different approach.
Okay.
And that is to use the power of media, their channels, to change the way kids are exposed to messages about food and activity, to change what they offer at their theme parks, right, and brand the healthier options. I think they're going to use Mickey's face or some such. The idea there that is pretty powerful, that Disney wins, right, because they have a healthier population to come visit their parks and walk around more and spend more time. And the employees that come to work for them are more fit in the future, and so their costs go down for health insurance. They're not the only corporation that's kind of getting it, right? Coca-Cola, McDonald's.
Coca-Cola's getting it? No.
They absolutely are. Coca-Cola in the state of Louisiana leaned forward and made changes in legislation that they requested to change the offerings in schools, to limit access to sugar-sweetened beverages to kids in schools in Louisiana. Ultimately, the corporation is going to make the business model work, right? And they are learning that there's a demand on the part of the community for healthier options. They're learning that people want water and juice and lower calorie drinks, right? And so their business model works for that. It's just like McDonald's learning to offer a different side. So there's going to be a lot of ways we'll tackle it. I think the big picture in this country is that over the course of time, we've been moving less and taking in more calories.
Got it.
The calories we have access to are very dense, and they're easy to get. We barely have to work to make a meal, right? It's just kind of in front of us. So as we've dialed that and made that change, we have to dial it back. And when big corporations like Disney and food vendors and Walmarts start to say, you know what, we're going to start to make that change, a little change on a big scale like that really makes a huge difference. To achieve the public health goal of 20, the national public health goal of a 2020 reduction in obesity for kids, right, that the Centers for Disease Control laid out, we basically need to take 100 calories out of the diet of every kid in this country. Now, 100 calories is like, it's not even a full apple, right? It's half of a Coca-Cola. It's a portion of a candy bar. It's really not a huge amount of calories in a day, or it's 20 minutes of exercise, right? So it's physical education in the school. So to get to, when you start to think on a big scale, as an individual person, it might feel scary and frustrating, but really when we all kind of team together, schools and others, and we make these small changes, we're going to make a big change in these kids' lives.
Well, I like that approach, you know what I mean? Because that's kind of why I'm laughing. I'm not, you know, because we spend a lot of time, and we already appreciate, coming from Tulane, Dr. Lydia Bazzano and Dr. Lee Wei Chen over at LSU, and Dr. Melinda Sumner. We really focus on the nutrition aspect, and then around the house, my wife, we have, we don't argue a lot, but one of the things that I said that she'll kill me. All right. One of the things that she really gets, is that, when I always go around the kitchen, and whenever I find the soft drinks and stuff, I just kind of throw them in the garbage can, you know what I mean? Take the crackers and stuff and throw them in the garbage can. And she'll say, well, where did it go? I'll just smile.
Well, you're kind of getting to two things that are really important. I want to make sure I mention. One of them is about the mixture of what's in the environment and what's our personal responsibility there, and that's a long conversation. I want to get back to it, but I want to answer your question first about our special relationship with food in New Orleans.
Right.
And so my husband is a New Orleanian for multiple generations, and his father is a New Orleanian that cooks like a New Orleanian. But my husband has learned to take the very same delicious food, gumbo, red beans, all of it, right?
Yeah.
Black and red fish, and make it in a way that is healthier. And it's, I promise you, it's equally delicious, if not more. And I think a lot of families are learning this at the table.
Right.
So, and in the kitchen. So it is possible for us to eat really well.
Okay.
We don't have to give up the things that we love. We just might need to change it a little. We might have, just not go back for seconds.
Okay.
Some of it might be special occasion and not all the time.
Right.
And we might need to add some stuff, right? Some fruits and vegetables, like make the plate a little more colorful and not just about sort of the fried chicken and the rice. We had a lot of really intense conversation about this in the meetings, and the kids, again, were really clear about it. In their school lunch, they want fruits and vegetables.
Okay.
They asked for it. It wasn't us, sort of saying these are the kinds of things that we should push. The Rethink kids, who you may be familiar with, are really pushing this hard in the school. So I think we can love the culture and food of this city. I think we have to be personally responsible about, if I'm going to eat that, then I'm going to make sure I'm being active so I can burn it off, and or I'm going to make it a special treat, or eat a little bit less than I might have, and or a little less butter, a little less whatever, and it can taste just as good.
Yeah, because Leah Chase had the cookbook, the Down Home Healthy or whatever, that it can be done. Will we? Because brown rice tastes much better than white rice and whole grain pasta. Will we be pushing, the whole grains? In that sense, will Fit NOLA get trying to market those things or whatever?
Yeah. So Fit NOLA is going to be working on increasing awareness, right? And part of that is about where is there healthier food and better places to be physically active, and what should you be eating, right? So there's a marketing and messaging piece about that. Other things that we're going to do is, for example, set standards so that you'll know that this is a Fit NOLA workplace, or this is a Fit NOLA Fit NOLA program or restaurant. There's some activity already happening in that area. So we do want to increase awareness in those ways. I think that everyone's got to make their choices, and the thing that we can do, that I can do as health commissioner in partnership with others, is educate folks. So being nutritionally fit means you got to have a balanced diet. It's fruits and vegetables, it's whole grains, it's fiber, it's all the things that your grandma always tells you to do because she knows what she's talking about, and it's good for you. But it's also about being physically fit. The data, the research and evidence tells us that actually physical exercise, walking, taking stairs, has really more benefit than just focusing on the weight loss piece. So if people exercise for 20 minutes a day, it improves their mental health, their physical health, their emotional health, their performance in schools, performance at work. So there's a lot of benefit to that. And I think what you're going to find with us is we're going to really focus a lot more on that. Biking, bike lanes, NORD programs, parks and playgrounds, getting people to take the stairs, right? Getting after-school programs going for kids, and getting physical activity back in the schools.
Hey, yeah, because physical activity, these kids, my kids, they don't have a concept of what physical activity PE really should be. You know what I mean? It's a whole different world. But you said something that's so key, and that's going to bring us right into the next point. Statement. If we literally attack people getting fit, or attack obesity, can that happen without dealing with families?
The family is at the core. I think schools are really important also. Children spend the bulk of their time with their parents and also at school. So in thinking about what kids take in and what they get to expend, is the nutritional and physical fitness piece.
Right.
Schools are a really important anchor in this because they're all going through, and we're feeding them, essentially.
Right.
We have control over what the kids get and or what's in the vending machines, and they can purchase. Right. Families, there's a couple of ways it can work. Parents can get engaged and role model for the kids, but like I spoke about the youth empowerment piece, kids can also drive that agenda.
Right.
So goal there is to empower them, educate the kids, so they can bring those things home, including learning to cook as a family,
right.
having meals. There's good data that says if you cook meals as a family, right. And grow a garden and pick that and put it on the table, it really helps kids understand about the origin of food, and they get better habits over time. First Lady is very big on this.
Right.
I mean, she's really set a great example with her own family about how important it is to teach kids and sometimes adults where food comes from, learn to prepare it in healthy ways, and learn to enjoy it together.
Right.
Make the meal something that we're doing as really a growth opportunity and a bonding opportunity. Same thing for physical fitness.
Right.
So we want families to think about this as the playground is not just a place where you might go and the child's going to swing on the swings.
Right.
This is a place where you walk to or you bike to as a family. You spend time together,
right.
and you're talking and laughing and walking around,
right.
and maybe you're going to play a little sports or whatever works for the family. I think it's going to be very critical. Again, a lot of folks talking about that, but I don't want to leave the schools out because the kids do spend a lot of time there, and they have a really important role to play in all of this, and they're ready to step forward and participate.
Well, and see, but the key is we live in Beirut, you know what I mean? We're here in Bangladesh. I mean, we're literally here in this third world city, you know what I mean, that wants to be a first world city, but the truth of the matter is statistics tell us that in certain neighborhoods, again, in certain neighborhoods, it's not all throughout, but in certain neighborhoods, where we're talking about the incarceration is so high as 70%. I mean, we literally, it's wiped out.
Right.
If we attack, and I think that's the key of, they can call it the medicalization of the violence in the city, but truly I think the New England Journal of Medicine and Lancet, they do the perfect job of looking at war-torn communities and looking at it from a health perspective, and you're a leader in that area. And I will say, before you even came to the city, you were a leader in that area, saying if we holistically deal with the community, then we're going to solve everything. And I'll throw this out, I believe that if we attack obesity, there's no way to attack obesity without attacking self-control. Without attacking self-control, we can't do that without dealing with the outer family. And that, in and of itself, we will be dealing with so many of the issues that's ripping apart families.
So it is true that when you start to look at the causes and consequences of obesity, that there are a lot of health disparities there that cut along racial and economic lines. And so if you're looking at the causes of overweight and obesity, which affects 2/3 of our community, right? So it's extremely common. In just a few years, almost 4 out of 10 kids are going to be obese, right? So we want to avoid that. So if you look at the causes, you mentioned them in a breath, and I'm going to emphasize them. Part of it, yes, is personal choice, and are you actually, if it's in front of you, choosing the healthier food option? Are you taking advantage of opportunities to be more active? Do you take the stairs when you can? But the built environment, where you live, learn, work, and play, matters a lot.
Yes.
And it's access to bike lanes, but it's more than that. It's, can you ride the bike in your neighborhood? Are the street lights on? Do the street lights work? Is it safe for you to get outside, right? Is the playground clean? Is the equipment in good shape? Is it a place that you want to bring your family? Is it a safe, well-lit environment that has the programming that you need? So the city sees that, the city government, that the big role we have to play in this is in the built environment and in some of the policy. So we want to keep building roads and bike lanes and turn on all the lights in this city, get the playgrounds all up and running, and have them be safe places to play. Make certain that there's good programming to reach kids through NORD and other efforts, and do what we can to get grocery stores, farmers markets, into neighborhoods that don't have access to fresh food. I knew this as a doctor. I know this, as the health commissioner, that I can tell you all day long to eat tomatoes, but if you don't have access to them because they're not sold in your neighborhood and it's not safe enough for you to go back and forth to get them, game off, right? So, built environment matters. Do you have the stairs? Do you have the playgrounds? Do you have the opportunity to be more active? Is it safe to be outside?
Right.
But also make the right choices. The safety piece is so critical, and I'm so happy that you mentioned it. Every conversation that we've had with some 100 folks organizations that have been involved in developing Fitnola, every community meeting I've been to, every focus group we've done, every time we talk to the kids, it comes up. I want to go out and play, but the playground doesn't feel safe, or we don't have a safe neighborhood. This is not a New Orleans specific issue. All across the country, same issue. So low-income neighborhoods, more likely to have violence in those neighborhoods, also more likely to have obesity. They're less likely to have that built environment, that infrastructure that supports all of it. So you are right in the sense that all the things that we're going to tackle around obesity, making sure the place is safe and works and it's a place you want to get outdoors and live and you have access to fresh fruits and vegetables and food, is the same kind of stuff we want to do to reduce violence in those neighborhoods.
Because, think about it right away, the person, and by no way anybody's saying that, because people aren't, gaining weight, that the reverse is true, that they're more likely to be violent. No, that's not the issue. Obviously, no one's saying that.
They're related, though.
Yeah, but
correlated.
They're definitely, but the thing of it is that, hey, part of my lack of self-control as far as for eating, I live in an unsafe environment. I don't feel, my life is too stressful. I don't have money. I don't have this. And don't tell me about getting fit. I'm trying to survive. I don't have a job. I don't, so if you're going to help my neighborhood, my 6-block square area get fit, when everybody's going to jail, they're getting shot, then you got to deal with these other issues. And in fact, if you deal with the fitness, you're creating connections. You're bringing people in. Somebody's saying, I care.
Yes. You know that the mayor's #1 initiative is NOLA for Life, murder reduction, and I think you know that I'm heavily involved in that.
I've watched it on TV.
We, in the 18 months that I've been doing this job, I started my narrative this way. Winnable battle, childhood obesity, really significant consequences for our community. But it immediately became clear that violence was the #1 public health issue in this community. Yeah. And that any way that I was going to tackle obesity, I had to be thinking about violence reduction. And as we have said, it turns out that some of the violence reduction initiatives actually can help us address the problems of poor fitness in this community. It's really critical, right? Because the whole thing is interrelated. If you want to, the reason I want people to be healthy, we've talked about this, is to fulfill their potential. Being healthy is great, right? And health has value, but ultimately health should be an afterthought, so that you want to be able to enjoy family, friends, go to school and learn and attain what you need to in your career, your job, whatever. And so the fitness piece is just a vehicle, right, to get people there, and we have to make sure that they have every tool in place to get there. So yes, violence is #1. Fitnola fits in with that very well. It is so important, though, for these kids that we're able to, that they are encouraged to stay physically and nutritionally fit. They're telling us that. Yeah. And in fact, very specifically related to the link to violence and fitness, there is good evidence that children who have less opportunity to be physically active during the day at school, to burn off that energy that we know they all have, and if their access to food during the day is just sugary stuff, they act out more. Every parent knows that.
Yes. Yeah, easy.
And there's some soft links to being expelled from school, and then the pathway that can lead kids down. So these Rethink children that are here in New Orleans had spent last summer doing some work on this with the support of the Robert Wood Johnson Foundation, and have encouraged across the school system physical fitness in schools, better nutrition, directly talking about violence. Because these children came up with this. They said, this matters because we want to stay in school, we want to be thinking and not worrying about these other issues, so feed us right and let us be active.
Hey, and it boils down to showing that you care. And I even add in there's the music in the brain program to show how music affects. And so we got music, nutrition. We're literally talking about the old-fashioned, real, true community, brings families together, you know, justice. Before we leave, just a couple of minutes, you know, systematically, though, from, you know, we see government in this, but looking at it from our standpoint, from a medical standpoint, you know, to me, police officers have, you know, stay away. Let the medical people get in here. You know what I mean? But our lead, the physician, I'm a pharmacist, we really back off and we turn this over to the social worker to really, is our lead person to go into these families where we have issue. All right, there's a death in the family, we got violence, you have somebody going to jail. We need a social worker in here. That's their training. Tell us a little bit about, I know we talked about the medical home, but
So, just to kind of jump on this thing about why people sometimes don't make the right choices, and I'm going to jump to link that. So because we didn't talk about it a whole lot, and it is true that people, some people's response to stress is to eat, and to eat wrong, and living in a stressful environment can do that. And without knowing what options and resources and whether somebody cares, sometimes people do get into a bad spot. It's not true for everybody, but it is. But it is part of it. As far as the violence reduction and the trauma, I'm going to use the word trauma. There is definitely family trauma issues in this community, not just from our Hurricane Katrina and other events, but what appears to be going back decades. There is a cycle of that. I think there's a cycle of families not knowing what resources are available to them. The health department has taken the lead in developing resource guides for mental health and substance abuse and physical health. Chris, that may sound simple, but we spent months going door to door to door to these organizations to make sure they were real. And then if somebody called, it was a real place.
You know, we just talked about, go ahead.
And that there was the kind of resources that would be available. So knowing what you have in hand to help people is one, then linking people with that. The ways to do that, for example, around violence are we have a reset program that the city does that isn't just city employees, it's clergy and counselors and social workers from agencies that go in neighborhoods and knock on doors and say, we're here to help, and if we're not the right person, face whatever, here's some other options, do you want to call? And then our ceasefire program has a similar issue. But we are leaning on and working with our community partners, faith-based, not-for-profit, you know, other agencies that have the kinds of social work support you're talking about, that can really make a difference in people's lives. It's going to take everybody focusing on the problem of reducing violence to make it work, and our children deserve that, just as they deserve to be fit. Well, I'm in. Excellent. I'm gonna recruit you. I'm gonna take you back. I got
no, we get.
You're already in is the thing, and I know that. I know that you're of the mind that you believe that we can do it, and that it's going to take though personal choices and effort, but it's also going to take all of us working together and making structural change that's permanent.
You know, Dr. DeSalvo, hey, you know, big fan. Hey, Chris Sylvain, Health Issues, healthissues2010.org. We're going to try and load up some of those resources. But we have to understand, hey, this is a critical time in our community, and there's no turning back. We have to fight as hard as we can and win. Thank you so much.